Hi, thank you for selecting this video series. Today I'm going to talk to you about um, headaches and toothaches. And my name is Vince, by the way. So, headaches and toothaches can be caused by a little known muscle that most people don't know about. It's called the sternocleidomastoid, or SCM. And that muscle is in your neck, believe it or not. So the way you find that muscle, easy way to find it is on both sides of your neck, is to kind of tense your tense your neck up like that. Turn your head to one side. See that muscle? And grab it. That's a thick muscle. So actually there are two cords to that muscle, or two stems. So grab it and make sure you got both. You can find that out by going down, and as you pull your fingers forward, the back muscle will slip out of your fingers. So you've got the front muscle, a front SEM, which is the sternal branch, because it attaches to your sternum. And then you've got the rear muscle. Uh, it's the clavicular branch, and it attaches to your clavicle. So sternal, clido, mastoid. So it connects. Those are points of connections, uh, and this is the mastoid process um, that controls your chewing and all that stuff. So grab that sucker and squeeze, and depending on where your headache is or your toothache, will depend on the pain that you feel. So you're gonna grab it and just kind of go up and down, and where you feel the most tenderness is where you need to uh, put your effort in. And it doesn't take a lot to do it. You'll notice when you squeeze it, the tenderness, and it may be excruciating depending on your symptoms. So in the sternal, the front one, uh, front cord, I'll call it. You want to grab that, and if you're massaging that, you feel tenderness, and your headache is above your eye, in the front here, on the head, back of the ear. You should find that tenderness, and you should find that as you rub that, those areas will start to be alleviated. Now the clavicular branch, which is right behind that, uh, will have cause pain um, in your that'll give you toothaches, can cause pain in your tooth area. So you want to rub that, grab that. Sometimes that one's a little hard to grab with your, usually I grab with a thumb and forefinger, or middle finger or some. So it's a little harder to grab that way. So you might need to take a couple fingers and push in there and massage and go all the way up and all the way down. As you feel the tenderness, that's where you concentrate, put your effort at. And the reason you're feeling those tenderness and tender spots, is because you're hitting trigger points. So that's what we're doing. We're doing some trigger point therapy. And a trigger point is basically a contracted muscle that's just stuck, and it won't uncontract. It's just causing all kinds of problems. And so a trigger point also usually refers pain elsewhere. So that means that uh, if I press here, I feel the pain here. Um, so that's a referred pain pattern, and that's a trigger point. And so that's how you treat your headaches um, and toothache. Remember, toothache, probably the clavicular branch, the second one back there will be most of your effort. And also just when you have things up here in this region, go ahead and massage both because they do refer pain in this general head, uh, back, neck area. So hopefully you've learned it. Uh, you remember both sides, you have it on both sides. So if you have pain on this side, concentrate on this side that you have pain on. Um, but also remember that if you have uh, more of a frontal type headache, it can um, be cross referenced by the opposite uh, SEM. So try both sides. When you have pain, feel the side that it's on and work that, but also check the other side just to make sure there's nothing going on over there and referring pain in the process too. So thank you for choosing this series. I hope you have great success. Please let me know how it goes. Thanks.